In the United States, a staggering number of people who suffer from chronic pain become addicted to opioid pain medications. Medical cannabis is being studied as an alternative due to its pain-relieving effects, but without the risk for addiction.
The problem with pain is bigger than cancer, diabetes, and heart disease combined. So it's a huge problem. I don't think even physicians are aware how big the problem is.
So if normally a cell would respond to a painful stimulus with a burst of activity, when the cannabinoid receptor is activating, that activity is attenuated. There is less activity. So less activity, less pain.
Opiates are not the solution. We now know that opiates should be used in a very small number of patients. The problem is with opiates is that they are very effective in the short term, but in long term they cause more harm than good. They actually cause death. I mean, we know that. So opiates should not be the first line of therapy. I'm not saying that cannabis should be the first line of therapy, but I think they should be used before opiates are used.
Psychiatrist Dr. Seth Resnick specializes in chronic pain and addiction medicine.
There have been patients for whom I do recommend cannabis, and those are typically at this point patients who have not responded to more traditional measures for managing chronic pain. I think that cannabis's potential benefits for addressing the opioid epidemic remains to be determined, but it's very promising. I think that it can certainly have the potential to limit the opioids in quantity and duration of use.
In states where cannabis is legal and where cannabis is actually available, it's not enough for it to be legal. It has to be available in stores. In those states, people use less opiates and fewer people die of opiate overdose.